I'm going to be your nurse today. We'll be doing the head-to-toe assessment. I'll be checking your skin, your heart, your lungs, your abdomen, and muscle strength. Do you have any questions?
No.
Okay. If you just sign this consent form for me, please. Okay. My patient has signed her consent form. Here is my paper. There's nothing written on it. It's a blank head-to-toe paper. Alright. I'm washing my hands. Can you tell me your name?
Linda Woodward.
Can you tell me what day it is?
April the 17th, 2020.
And can you tell me where you're at?
My house in Damascus, Virginia.
The client is oriented ×3. Now I'll be checking your blood pressure. I'm going to put this on your arm. Is this arm okay?
Yes.
Alright. Her arm is at heart level, and I'm going to be lining the cuff up with her brachial artery. Your blood pressure is normal, 124/80. Okay. Now I'll be checking your eyes, your ears, and your mouth. I'll put this pillow back. Can you take your glasses off for me, please? Okay. Her eyebrows are symmetric. They are full and well groomed. Her eyelashes are full. Her sclera and cornea are clear. Can you hold down your eyelids for me? I'll check your conjunctiva. It is pink and her eyes are moist. Next, I'll be checking your pupil size. They are a 4, bilaterally symmetric. Now I'll be just shining this light into your eye. Is that okay?
Yes.
Okay, just look straight forward for me. The pupils constrict symmetrically when I shine the light in one eye and then in the other. Next, I'll check for accommodation, so I'm just going to put this pin light in front of your face, and just, when I tell you to look at it, just look at it for me. Okay, look at it. Her pupils constrict to accommodate to look at the pin. Next, I'll be checking your ears. The ears are rounded, there's no deformities, they are tan and uniform in color. I don't see any lesions or inner ear drainage. I'm checking the other side. This ear is round, there's no deformities, there is the tan in color and uniform. There's no lesions or inner ear drainage. Next, I'll be checking your lips. They are pink and moist. Can you open up for me, please? Her upper palate and the insides of both cheeks are pink and moist. Can you stick your tongue out and say ah? Her tongue is pink and moist. And can you show me your teeth? Her teeth are white. They are clean. I don't see any cavities. Her gums are light pink, healthy. I don't see any lesions, and they're moist, and they don't cover her teeth. Now I'll be checking your neck. I'm going to palpate the carotid arteries one at a time. They are strong 2+ bilaterally. Now I'm going to check your trachea. It is midline. I'm going to pinch up some skin. Turgor is brisk and quick. May I see your arms, please? Her arms are tan, uniform in color. I don't see any lesions anteriorly or posteriorly or bruising or bug bites. The temperature is warm, dry. I am going to check your radial pulse so you can just relax. I'm checking radial. Radial pulse is 2+ strong. Now may I see your hands, please? There is no evidence of clubbing. Her fingernails are well attached. They are pink, round. The capillary refill is less than 3 seconds. I don't see any lesions or spots on her hands. There's no extra fingers or missing fingers. Okay, and there's no vascularity on her arms. Now I'll be checking her legs. If you just hold this down for me, please. Okay, her legs are uniform in color, tan. They are smooth and dry. I don't see any lesions or scratches or bug bites anteriorly or posteriorly. I don't see any vascularities. I'm going to check for edema. I'm going to count for 5 seconds and then check. 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi. There is no edema. Now I'll be checking her pedal pulses. They are strong 2+. I'm checking the capillary refill in her toenails. They're less than 3 seconds. And can you push down on my hands, please? Her plantar flexion is 5+ strong. Okay, and I'm going to wash my hands again. And can you squeeze my hands? I'm going to check your strength here. Her hand strength is 5+ strong. Next, I will be checking your lungs. I'm first going to check your anterior to posterior diameter. It is less than half transverse, so AP is less than transverse. I am checking, can you just take a deep breath for me? Her chest rises and falls symmetrically. Now I'm going to listen to about 6 to 8 spots in the front and the back just to get a good listen. Okay. Just take a deep breath for me. Okay, now we're going to check 2 spots. If we can raise your shirt up, if that's okay, and we'll cover you up with this one. Okay. Anteriorly, her breath sounds are there. They're clear. The dominant sound is visceral. I don't hear any abnormalities such as crackles, wheezes, or rhonchi. Now we'll be checking your posterior. If I can just get you to sit on this stool so I can get a better view. Okay. Now we'll use this blanket to cover you up. Just take deep breaths for me. Now I'm going to raise your shirt up. Let's just take this and cover you up. Okay, and if you can just raise this arm, I'm going to check under here too. Okay. The lung sounds are clear and present on the posterior side. There is no abnormalities such as wheezing, rhonchi, or crackles. Okay. Next, we will be doing checking your heart. So if you just lay down for me, I'll cover you up. Okay. I'm going to first listen with the diaphragm of my stethoscope, and then I'm going to check with the bell, and just to get a good sound, and then I'm going to stop and check your apical pulse for a whole minute. I'm first starting at the second intercostal space, right sternal border, and that is aortic. Next, I'm going to the second intercostal space, left sternal border, and that is pulmonic. Now I'm going down to the third intercostal space, left sternal border, and that's herbs. Okay. Now I'm going to just lift your shirt up so I can listen to 2 more spots. Is that okay?
Yes.
Okay. Now I'm at the fourth intercostal space, left sternal border, and that is tricuspid. And now Now I'm going over to the fifth intercostal space, midclavicular line, and that is mitral, and I will be staying here for a whole minute. Okay, your pulse is a normal of 67. Now I'm going to go back and check with the bell. I'm starting at the fifth intercostal space, midclavicular line, mitral. Now I'm going to the fourth intercostal space, left sternal border, and that is tricuspid. Now I'm going up to the third intercostal space, left sternal border, and that is ERB. Now I'm going up to the second intercostal space, and that is left sternal border, and that's pulmonic. Now I'm going over to the second intercostal space, right sternal border, and that is aortic. I didn't hear the heart sounds were normal. There were no extra heart sounds or splitting or murmurs. I'm also looking across her chest. I don't see any heaving or lifting. Next, I'll be checking your abdomen, so is it okay if I raise your shirt up?
Yeah.
Okay, I'll cover it up right here. First, I'm looking across. The contour is flat. I don't see any extra pulsations or peristalsis. Next, I'm checking the umbilicus. There is no redness, swelling, or drainage. It is midline. Okay, now I'm going to be listening to 4 quadrants to hear for bowel sounds. There is bowel sounds in all 4 quadrants, and it's normal active. Next, I'll be palpating, first with one hand lightly, and then second with both hands and just a little bit deeper. So just let me know if you feel any tenderness. Did you feel any tenderness?
Mm-hmm.
She does not feel any tenderness. I did not feel any masses or yarding. Now I'll be palpating with both hands just a little deeper. Did you have any tenderness?
Mm.
She didn't have any tenderness. I didn't feel any masses or enlarged organs. Okay, we are done with the abdomen. Now I will be checking your spine, so if you could just stand up for me, please. Okay, first I will be palpating. Is it okay if I raise your shirt up?
Yes.
Okay. The spine is midline, straight. Is there any tenderness when I palpate?
No.
No tenderness. Can you just bend over just a little bit for me, please? Okay. I don't see any signs of scoliosis, kyphosis, or lordosis. And there's no lesions or masses on her back. You may sit back down. Do you have any questions?
No.
Okay. I am washing my hands, and that is the end of my head to toe assessment.